Health Secretary has called for anyone who visited the Canterbury nightclub at the centre of a meningitis outbreak to come forward and receive both antibiotics and a vaccine. Wes Streeting made the announcement as he visited the University of Kent. A temporary vaccination programme there has now been expanded to cover all staff and students. Our health correspondent Dominic Hughes reports.
By mid-morning, more than 900 doses of meningitis B vaccine had been administered, with more students and staff at Kent University queuing for their jabs. The idea of the vaccine is to protect those who may have been exposed to the infection, and it's also helped reassure them in a time of growing anxiety.
It's brilliant that the NHS is rolling it out for people our age, especially when, something like this is happening, and the fact that we're getting it for free.
It gives everyone peace of mind. Like, my mum's really happy about it, like my family's happy about it, they feel safe.
I haven't been in contact. I was just in my room anyway, but just in case, it's good to be prepared.
The Health Secretary, Wes Streeting, has been visiting the vaccination centre this morning, a sports hall on the university campus, and he's announced an extension to the vaccine rollout.
We are now encouraging anyone who attended Club Chemistry from the 5th of March until it voluntarily closed to come forward for both antibiotics and vaccination. Furthermore, we're expanding vaccination to anyone who's previously been offered the prophylactic antibiotic. That will include a larger number of students here at the University of Kent. It will include some students at Canterbury Christchurch University, and it will also include sixth formers at 4 schools where we've got known or suspected cases.
There is roughly a case per day of meningitis across the UK, but public health officials are still trying to work out exactly why there's been such an explosive outbreak of cases in Kent.
The scale of the transmission event that we've seen is really, really unusual, and it's certainly not something I've seen in my career. Cases are normal. We do sometimes see cases in universities and small clusters, but what's unusual is the rapid increase that we saw around the 13th of March, and certainly it is very unusual to see such a high number of cases.
This nightclub in Canterbury is where at least the initial cluster of cases seems to have started. The club's owner says it's a very worrying time and wants a wider vaccine rollout.
I think for now the focus has to be on getting the rollout of the vaccine, getting as many people and offering it to as many people as possible. I'm not suggesting that everybody should have it if they don't want to have it, but I think the option for them should be there.
More cases may yet emerge. The incubation period for the illness means some people may not yet have been identified. But health experts are stressing the wider risk to the rest of the country is still extremely low. Dominic Hughes, BBC News.
Our reporter Simon Jones is in Canterbury. And Simon, we've been hearing this afternoon that the vaccine rollout is being expanded. What will that mean?
Yeah, and in fact, it's a massive expansion of the vaccination programme. Initially, it only applied to around 5,000 students who lived here on campus at the University of Kent in halls of residence. But now the university has written to staff and students saying anyone can come for a vaccination. That's around 16,000 people. There's a little bit of confusion because I think the government is saying it should be focused on people who've come into close contact with confirmed cases, but it's also going to apply to some students at the other university in the city, Canterbury Christchurch, pupils at sixth form where there have been confirmed cases, and also anyone who was in the Club Chemistry nightclub from the 3rd of March onwards. So that will be thousands more people. And as news has emerged of this expansion, we've seen the queues grow and grow this lunchtime. But for some MPs that isn't going to be enough, because 40 MPs have written to the Health Secretary saying they want to see a catch-up programme for all university students. The issue is that the meningitis B vaccine was only rolled out in 2015 to babies and young children, so it wouldn't apply to the cohort here. The government says that is going to be kept under review. Today they've got 2,000 vaccines available, and judging by the queues, they might need them.
Simon, thank you. Simon Jones in Canterbury.